About 8:53 the time. From the front line of the battlefield, the front line of the NHS, a national scheme to help veterans find work in the health service is being launched today.
Step into Health is what it's called, and it wants to help former military personnel and their families find new careers. 50 trusts have signed up to the initiative, which is being officially launched by Prince William this afternoon.
So let's talk about it now. We're joined by Tiffany Hemming and Kofi Korti, who both served in the army and have now moved into jobs within the NHS. Very good morning to both of you.
Good morning.
So, Kofi, can I start with you? Tell us a little bit about what you did in the military. What was your military career?
So I was a combat medic technician, we call CMT, and I was with the boys and girls on front line, both when we deploy or back home, just looking at their medical needs.
OK, so you finished your military career, and what happens next?
So I was actually medically discharged, so throughout my military career and in Afghanistan I got injured, and afterwards I had to leave the service out of my injuries, and then I had to look for another career. For me it was exploring what next, because when you are in service you get regimented and you just think what is out there for me. And so the NHS jumped out to me when I went for this program called Step into Health, where I thought this is a natural transition for me.
And we'll talk about what you're doing now in a moment, but Tiffany, can we have your story as well?
Well, I've served for about 20 years in the military, and I realised that I was ready for a new challenge. And someone mentioned Step into Health to me, so I went and did an insight day at Norfolk and Norwich Hospital and thought this is a good place to be, I quite like this. And then I got myself an attachment to Guy's and St Thomas's, and that really sold it to me that the NHS was where I wanted to go. What's
interesting is, I mean, you're both having gone from high-pressured situations. Kofi, you said you were on the front line with dealing with immediate emergencies. Tiffany, you're going to hospitals which, well, all hospitals now, busy. It's a high-pressured environment. So that's not what you're shying away from at all. So I imagine there are people that the NHS would be grabbing you with both hands.
I think the NHS has realised that military personnel have got lots of skills that are very transferable, directly related to what they would like to use.
Which do you find more stressful?
I think they're very different. I don't think there's particular different stresses in either one. They're just busy. There's operational things to do. There's strategic things to do, and it's.
And can you explain the different roles in the military? Your role was what?
In the military, I actually joined as a vet, but I ended up as a medical manager. So very similar to what I'm doing now, but you don't need to have been a medical manager or a medical type person in defence to be wanted by the NHS. They'll be quite happy to take you wherever you come from in the forces or elsewhere if you've got those skills.
And Kofi, similarly, what's your role now? We know what you did in the military.
So I started with the NHS as an instructor, because I was an instructor in the army as well, but now I'm a project manager in Hampshire hospitals.
We're specific to what? In what line of work? What are you working on?
So I look after on-schedule care, and I'm looking after a GP streaming. So we are, just to ease the pressure on within the emergency department, we are trying to infuse GPs into the system, where cases where it's minor illness will be seen by GPs, so we can ease the pressure on our consultants.
Was there a training programme involved in terms of transitioning from the military to the NHS? I mean, what would that have involved in terms of time, hours?
So with the Step into Health, you can come in for placement or work experience, which is anything from 1 day to 4 weeks. And that gives an exposure to what the NHS can offer. I just want to mention here that personally, when we're leaving, we all think the NHS is just made up of doctors and nurses. Until you go for this program, you realize the NHS is a huge organization, and it's employing or has careers, about 300 careers that everybody can explore.
Tiffany, I mean, a number of times, NHS, particularly recently, with the pressure they're under, wards have been described as being a bit like a war zone with, the trolleys lined up and that kind of feel to it. Are there, and I don't want you to get involved in the politics of this, but clearly working under pressure, which is a lot of what the military teaches you to do in whatever circumstance, those are transferable skills, presumably.
They're very transferable. The fact that we're very good at assessing a situation and making a decision quite quickly enables us to help get things done.
What about the red tape, though? Because in the military, things are, I mean, I imagine fairly straightforward, aren't they, in terms of lines of command and who gets listened to and makes decisions. Is that sometimes frustrating within a big organisation?
I think you'll find that the NHS and the military are very similar in terms of their bureaucracy and lines of hierarchy and communication. So there's not much difference, to be honest. When you're on operations, you get things done. And when you're in a hospital situation, when it's busy, you get things done too. So actually, it just feels like being at home.
It's very interesting. Thank you both very much for your time this morning.